I'll just stay seating if that's all right with everybody. um, no, just a real quick. Want to do a quick background on myself. My name's Eric Lulow, and like Dr. Walker said, I work for the Substance Abuse and Mental Health Services Administration in the Child, Adolescent, and Family branch, and I'm a public health advisor there, overseeing some of the grants that we give out to communities to provide mental health services for children, youth, and families. My background and expertise is in youth development and youth engagement issues, and in transitional age youth issues as well. A lot of that expertise is derived from my lived experience. I actually grew up in the foster care system on the west side of Detroit, Michigan, and kind of transitioned through several different homes. Was adopted by my paternal grandparents. Unfortunately, my adoption failed, and I lived with various relatives until I turned 18, at which time I was homeless. And then just kind of through the support of my community, was able to put myself through college, get a degree in social work, and then one thing led to another, and now I'm working here on a federal level, providing that perspective to the work that I do in this field. So I feel very fortunate to be with an organization that really embodiments, that youth-driven component, which I'll talk a little bit about in my comments. Just to be really quick with some of the things that I saw, I was really passionate to hear the early morning conversation around like health insurance and then the movement that's happening there, because I actually went without health insurance from 18 to 24, so I know what that's like and how difficult it is to get your needs met when that's the case. And so some of the things that actually really helped me get in touch with some of those services was there's a college program we helped start at my university. It was called the Next Step program, and it's actually something that's springing up at other different universities. It's not always called Next Step. They have different names for it. But these are programs that are identifying young people with additional challenges. Maybe they're coming out of the foster care system, coming through or involved in the mental health systems, and helping them adjust to college life. And providing them with a network of supports that are there and around campus. So I think if some more research work, some more studies was done on those particular programs and how they're benefiting and how they can be replicated as well too. And also this morning I noticed that there were some I was really pleased to hear the studies around trauma and the intersection of trauma with the work with transitional age youth. I myself have been diagnosed with PTSD, anxiety, and depression. So looking at that cross section and how we address this particular population, and I noticed from Dr. Einstein's top 10 self-reported reasons why youth don't do well in a post-secondary education, 3 of those top reasons were stress, anxiety, and depression, and that's definitely I could relate to that. So I think those programs are really good, and we should look at those and look at things with more trauma-informed lens and how we provide services. I was also, we talked a lot about resiliency today and what is resiliency and the genetic trait of resiliency or how you instill resiliency. Now, I really feel that self-efficacy is a key component in that. And it's really about how we build self-efficacy in this population that's been very disenfranchised. And I'm speaking of more of not a broader picture, but a more particular focus on populations that are more at risk, those aging out of foster care, those with the diagnosis of a social emotional behavioral health need, and minority youth populations as well. I was really surprised to hear that on par that the basic feeling of their self-esteem was pretty even throughout. I was really shocked by that, because I know for myself, struggling with some of these things about not having a job, not having the same level of education as my peers, not having all this stuff, really makes you question a lot about yourself and your own abilities and things like that, which really can make you look at a barrier as an obstacle that you cannot get over. And so increasing that level of self-efficacy, I think, is critical to building resilience. Also, I think one of the things that helped me transition, like I said, my community was very supportive, and that was through a lot of the pro-social activities I was involved in. I love seeing 4-H here, the 4-H representation here. I was a 4-Her as well as many other things, and I learned public speaking through 4-H. So they definitely gave me a skill set that I've benefited from. But I think really some of the key things, and I'm gonna be quiet here, are more research and work being done to provide supports for family support providers and youth peer-to-peer workers. These are services that can be, and in some cases are, Medicaid reimbursable services, where I think it instills a buy-in and a trust and a rapport with programs and service delivery models. You know, word of mouth is definitely, I think, the best way to get resources out there to people in the community, and you know, supporting these types of this type of work is critical to that. And I think two of the things that kind of popped out to me, one of the things that I got to see in one of my communities that I oversee is they're really doing a great job with this asset mapping project, where youth are learning how to do like literature reviews, research work, and asset mapping, and they're really telling police officers, hey, this is where if you come into contact with a young person at 3 a.m., these are places where like they can get services if they're in a mental health crisis, or like trauma centers, as Dr. Corbin was talking about. These are where can we break that cycle that's happening. And so I think doing some and utilizing technology for that. I mean, it'd be great if an ER doctor can like pull out his iPhone and get an app that tells them like these are the places that are open right now, instead of just discharging them to the street. And this is just a thought, and I'm not sure if this is something we can do as well, but like I was thinking about the work that's being done around the alcohol and the calorie intake and the exercise you have to do. Like if there was an app for that as well, where young people can learn it. Because one of the things I was shocked to learn is that like when I have like 2 of those solo cups, I'm really having like 4 drinks instead of 2 drinks. There's like but learning those different things, through an application of realizing like how over the limit you actually are, depending on like your body weight and size and all that kind of stuff, I think would be good too. I don't know if I want my cell phone telling me that I have an issue and need to go get services. I mean, they're getting too bossy as it is. So, but it could be a very good resource. So, for that.